This toolkit presents strategies to promote, protect and support breastfeeding practices of refugee mothers with PTSD. It is developed in consultation with the healthcare providers and patient partners. Refugee mothers are the most vulnerable group who often face trauma due to war, natural disaster and subsequent homelessness. The forced migration after a war or natural disaster often ends up refugee mothers and their family member into disaster relief camps that lack basic facilities. The vulnerable group of refugee mothers with young children often migrate to a new country where they face additional challenges. Refugee mothers face additional trauma in the new country due to lack of documentation and needed skills, financial constraints, inaccessibility to healthcare services, lack of transportation, lack of access to affordable housing, and parenting challenges while being in a new country. Additionally, refugee mothers often lack need-based breastfeeding support and services in a new country. Refugee mothers face many barriers to their breastfeeding practices, including lack of support, pressure to assimilate in the new country, racial stigma and inequalities, and lack of culturally sensitive care. These breastfeeding barriers are often combined with language barrier, misinformation, the norm of feeding formula, and post-traumatic stress disorder. Strategies to promote breastfeeding practices of refugee mothers with PTSD. Refugee mothers with young children must be offered trauma-informed care. Non-judgmental assessment of refugee mothers is essential in all healthcare settings. It is imperative to notice non-verbal cues and provide safe environment to refugee mothers where they can express their feelings without any fear. Healthcare providers must take a warm approach while caring for refugee mothers. This includes spending additional time with refugee mothers, ensuring their comfort and asking open-ended questions for their safety assessment. Refugee mothers must be provided psychosocial assistance in hospital and community-based settings. Observation of mother-child relationship and identification of PTSD is essential to assure maternal and child well-being. It is important to debunk myths surrounding PTSD and breastfeeding. Mothers should be reassured that their breast milk is the safest and best option for their babies. Healthcare providers must offer breastfeeding education, support, and need-based counseling in diverse care settings, including hospital and community-based settings. Community-based follow-up care and services is essential to promote, protect and support breastfeeding practices of refugee mothers undergoing PTSD. Refugee mothers' preference regarding interpreters should be considered while providing them care. During care provision, it is essential to discover when and what seems to trigger stress among refugee mothers. Reassurance and support are important care aspects and priority measures. Healthcare providers can teach refugee mothers on ways to regulate their stress and anger. It is also essential to promote self-care activities among refugee mothers with PTSD. Healthcare providers must demonstrate cultural sensitivity and humility during all aspects of their care in hospital and diverse community-based settings. Mothers' religious and cultural preferences must be respected and they should be offered culturally appropriate meals in hospital. Refugee mothers must be provided with easy-to-understand information on affordable and accessible mental health resources and services. Family must be involved in care of refugee mothers with young children. Educating and supporting entire family about mental health well-being is another important consideration to assure well-being of the refugee mothers. Healthcare providers must encourage social support from members of various cultures by formulating breastfeeding support groups and peer support programs. Interdisciplinary collaboration and consistent efforts are vital to promote, protect and support breastfeeding practices of refugee mothers with PTSD. It is essential for healthcare providers to effectively collaborate with religious and community organizations offering social services to refugee families, especially mothers with young children. Healthcare providers must advocate for the migrant health centers that are baby-friendly. These centers can be an additional avenues to provide need-based care and services to the refugee mothers with PTSD.